Different types of shoulder pain. There's the one that's at the tip of the shoulder. There's the one that goes down the arm. There's the one that you can barely even lift your arm up, while the other one you can. There's the one that you feel it in the trap, in the base of the neck. If you're suffering from shoulder pain, you're gonna wanna watch this video. I'm Dr. Matthew Posa. Welcome to the page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. There's a lot of different reasons why people can have shoulder pain. You can strain one of the muscles in the back. You can hurt your trap. You can have an impingement type of problem. You can have a nerve problem. The problem with all of this is that there are so many different reasons for it. Having the proper assessment is really going to be your best tool. And as a chiropractor, what I'm looking for is when we're assessing the spine and we're looking at the alignment, so we're making sure the spine is straight, we're making sure that there is a curve in your spine, so we would be checking for this because we want to make sure that the nerves that come out of your neck, the ones that are going into your shoulder, are free, that there's no pressure on it, there's nothing happening in the spine that could be the reason why you're getting the shoulder pain. And I can tell you, after treating thousands of people with shoulder pain and neck pain, that there's a relationship between your neck and what's happening in your shoulder. In the middle of your spine can even be rotated, twisted, your shoulders come up, your scapulas don't sit right. But in this video, I'm gonna go through the number one muscle that I find all the time that we need to make sure that you have a way of breaking that up and loosening it. And then I'm gonna show you a strengthening exercise that's gonna help you with stabilizing your shoulders so you don't create further strain or pain. The number one muscle that causes most of the issues is something called the supraspinatus muscle. Now the supraspinatus is supra, meaning above, spine, the spinatus, and that is part of your scapula. So this part right back here. So there's a muscle that's above, so it'll be in through here. And what's really special about this muscle is this muscle travels from right around in through the trap, so the area that you're most likely gonna have knots and you're gonna feel that, it'll be pretty tight. And as you come down, the muscle keeps going and then it goes right to the tip of the shoulder. And then the tendon attaches into the head of the humerus or your arm. And so what's happening is every time you go to move your arm, in particular little movements, just lifting your arm a little bit, going to grab something, that muscle is the one that's doing the job. It isn't your actual shoulders. And so a lot of people get confused with this because that's where you feel it. You feel it right here, or you feel it come down your arm. But the reality is it's back here. So the supraspinatus muscle is a really tough muscle to get to, especially on your own. I'm gonna show you a couple ways that I personally use in order to help myself and patients get the relief that they're looking for. And then I'm gonna show you one of the exercises that I love doing to stabilize it. Now the big thing with the supraspinatus muscle is that it is hard to get to. So I'm gonna recommend that you use a ball. And one of the balls, or the favorite type of ball that I like to use, is one that won't fall, won't compress, won't divot in. I'm gonna recommend that you use something called a lacrosse ball. Here's the lacrosse ball. So it is hard, it is rubbery, and it is great to use against the wall. So I'm gonna show you how to do that. So using the wall, you're gonna put the ball against the wall and you're gonna go right into those trigger points. So you're gonna start by, so you can bring your arm across your body this way, or just let your arm dangle. And what you're gonna do is you're gonna roll the ball right into those pressure points, and you're gonna feel them right at the base here of your neck. You're gonna roll sideways, so you can start this way, so you're going back and forth. And then as you get more comfortable, you can go up and down, find those trigger points, releasing them. Start to get your arm involved into that. So as the ball is rolling, you can bring out your arm and start doing some active release therapy where you're lifting your arm as you roll it. So I would look something like this, where you're lifting it and then back down. And again, and that's the motion that that muscle normally is responsible for. So you're able to work through that motion. And you can do that for as long as you want, but generally about 30 seconds to a minute of doing that will get you the relief that you're looking for, and that should calm everything down. So this muscle, what you're gonna wanna do is you're gonna wanna stretch it. Now, how do you stretch it? The best way to stretch it is if you're gonna do, let's say, your right shoulder, take your right arm, bring it as far back as you can. So you wanna bring it as far back, and then what you wanna do is grab with your other arm, grab your wrist, let your shoulder go. So you want to let this fall, and then as it falls, you're going to keep pulling on this and just let it fall. And you're going to feel that muscle release because it's in a weird spot. The other way of doing this is you can grab the back of your elbow, bring it across your body. Now this is usually one that you'll use for some of the other shoulder muscles, but a good or an other way of doing it, I wouldn't say it's a good way, it is a hard way of doing it, is to not only pull, so you're pulling on this, but then slightly aim up. And as you do that, drop the shoulder down. So that way you're creating that traction on the shoulder and you're lifting it up, and then you can get relief with that one. The other thing I want to show you is how to stabilize your scapula. And the reason why we're going to talk about that today is because one of the reasons why this even happens in the first place, other than having a problem in your neck, an alignment in your spine, or nerve pressure, again, that is something, go get that checked, because if you've had this for a long time, or if you've even had shoulder surgery, if you've had treatment on your shoulder for years and you're still in the same position, it could be because the nerve is actually causing the problem. So make sure that you're getting a proper assessment of the lower part of your neck. But if you're gonna stabilize your scapula, there's an easy way of doing this exercise. And some people call this like a wall clock. So what you wanna do is take, let's say your hand, you're gonna touch the base of the scapula and you're gonna set the scapula back. So you're gonna push it back. And then what you're gonna do with your right arm is you're going to start lifting it up. But the point here is that you're not letting go of the scapula as you're lifting. You are compressing the scapula back as you're going up, up, and up. And you want to go as far as you can. If that's the part that you let go, then again, that's how you're going to be working it. And so it's nice, it's slow, it's controlled. But this exercise is going to create the stability that you're looking for, that's going to take pressure off of your shoulders. It's going to draw your shoulders back, so it'll help also with posture and other things. But now your body's going to have far better control of your shoulders and range of motion, so that way you're not hurting that muscle. If you're suffering with that shoulder pain, go ahead and give that a try. I really hope this video helps you get the answers that you're looking for, especially since that is the most common muscle impingement source that I can find here in the office. And so that information I know can help so many people avoid a lot of nasties. But the number one thing, and I hope you got this from the start, is that a lot of the problem is not only the muscle, but it's the control system, and that is the nerves that are controlling that muscle. And at the end of the day, that's where the source of the problem can be. And a lot of people aren't checking that. Obviously, they're gonna be checking their shoulder, but they're not looking at what is controlling it. What tells the muscle to relax? What tells the muscle to spasm? What tells the muscle what to do is the nervous system. And those nerves come out of the neck. If there's any damage at the base of the neck, that could be the reason why this keeps coming back. If you have a question, you can leave it down below. Until next time, we'll talk to you soon.